This programme was produced at and first aired on MPR, Manawatu People's Radio, with support from New Zealand On Air. Ka pai Irarangi Te Motu, MPR.
Kia ora e te whara. Welcome to RIMA Kōrero, and welcome back to our previous listeners, and a huge welcome to our new listeners. You are listening to RIMA Kōrero on MPR, Manawatu's People Radio, and today episode we are going to talk about healthcare home with our special guests, Donna Stephen. Say hi, Donna.
Hi.
With Jude Bartlett.
Yes, hello.
Hello.
Nice to see you, February.
And Rebecca Walkden.
Kia ora, February.
Kia ora. Thank you for coming here.
Thanks for having us.
Let's take out the nerves.
Yep.
No nerves here.
Cool.
No nerves. Yep.
No
We
nerves.
will rock it.
We're rocking. We're rocking.
Luckily, you have the healthcare home rock stars
We are.
in
You
the
do.
studio
Yep.
with you today, February.
You are.
We are.
Thank you. Welcome to this fancy studio. Thank you to the
Beautiful.
Manawatu People's Radio.
Thank you indeed.
Thank you.
It's lovely in here. They've done it's
Yeah.
an amazing resource for the
Love the
community.
green.
I know,
Love the
right?
shade
Who
of
knew we'd have
green.
this opportunity, hey?
Oh, no.
It's
Yep.
In the
fantastic.
sanctum of...
Yep.
Who's that phone that's going?
No, not my phone.
Could be mine.
It's
not
mine.
me,
It's on
everyone.
silent. It's on silent. That's
It's
interesting.
Rebecca.
It's Rebecca.
It's
It's on
Honestly.
silent.
it's okay. It's okay.
It's Rebecca.
It's on silent.
There's no such thing as silence
It's
in a...
vibrating.
No.
No
studio.
worries. It happens every time. Oh my god. Rebecca literally put it away like
Yeah,
It's
2
on a
meters away.
non-vibrating surface.
just dug a hole and buried it.
Yeah.
Yep. So should we just wing it?
Let's go.
Let's go.
Who wants to start introducing themselves?
I think Jude
Start
would
with
be the
who?
best person.
Okay.
Come on, Jude.
I'm
Go,
Jude. And I'm lucky enough to be part of the healthcare home team.
Yeah.
And our goal is to improve a model of care for patients so that they have a far better experience of the healthcare system.
Yep.
And we also work in the equity space to ensure that equity is built into business as usual for our practices. And we also, hopefully, out of healthcare home program will also come a lot of capacity and safety and good support for our providers as well, because without the providers, nothing can happen in that space. They're such an important and valuable resource. So hopefully we hit those 3 or 4 key things.
True.
And I'm really lucky to be part of this team because it is genuinely the best.
Yeah. I can
Of
tell.
all the teams,
Yeah.
don't put this on THINK Hauora just in case all the other teams are jealous. But actually, my team is the greatest. Thank you.
Yeah.
It is. It is. I acknowledge that. And who's next?
I'll start. I'll follow on from the wonderful Jude. I'm Donna. I have a nursing background, and I've worked in primary healthcare for over 10 years, and I've always thought that we can do things differently. A lot of the way that we've been doing primary healthcare, it's not necessarily about the patient being the focus. The whānau and the person should be the centre.
The centre, yeah.
Of what we do. And that's what I love about healthcare home is supporting GP practices to sort of step up, do things a little bit differently. And it's actually, I always believe that if you're doing things the wrong way, it's hard. So, it's, I don't know, wipe that bit.
Nope, there's no deleting.
No,
No
there's got to be deleting. So, I love working with GP teams. They're an amazing resource. I really love working with the people and watching really amazing things happen and improving access for people and opening people's eyes to a different way of doing something. It's very exciting. And
It sounds
It's a-
exciting.
it's a place of innovation, which is cool.
Wow.
Wow, that is a hard act to follow. So I'm Rebecca. I'm also in the healthcare home team. Really lucky to work with these beautiful ladies and really excited to have healthcare home in our region. We've sort of had a bit of a presence for a few years, but this year with the Rockstar team, we are making a big difference in this region. And our community really does need that extra layer of support that healthcare home can bring in practices. It is a really neat model. It's based on models from the UK, from the US, and taking into account some Indigenous models like a model in Alaska, Nuka model. And what it's doing, we absolutely acknowledge GP practices have been doing some amazing work. The staff do amazing work every day in general practice. And healthcare home, I suppose, was a bit of ahead of its time in that it's had this framework and this sort of vision and intention of how far now focused healthcare will be. And it's really just an enabler to help those practices bring everything together. It gives them the toolkit with us helping carry that toolbox to actually empower the staff to be able to empower their patients, because that's it. It's the self-empowerment. We're all responsible for our healthcare. We're all should be empowered to lead their healthiest lives.
Fantastic. And I really like the words empowered. Empowering people, right?
We only work in a really positive space. And I think that's really important part of us delivering the healthcare home program to GP teams to support their patients, because there's so much pressure on GPs and the people who work in that space at the moment. You know, there's COVID, there's vaccinations, there's business as usual, and it's really easy to complain.
Yeah.
But it's not as easy to actually see the wonderful men and women who are working in that space and to see what they actually do, the education they bring to the table, the care, the knowledge, the resource. And that's what we're trying to do. We're trying to empower patients to use their GP teams as a resource to get what they want, because there is an understanding that health does not just happen in a face-to-face appointment. Health is many areas. And part of what we do as a team as well, that I'm sure both my colleagues will speak to, is this, how we look at the social determinants of health. And actually sometimes it's okay for the GP teams to refer to those powerful community organisations, look at different ways to support somebody in their health that might not actually sit in a clinician's room. So there's a lot of really powerful things that come out of healthcare home, but the best thing about it is the positivity with which we treat and deal with not only our patients but our GP teams.
Oh, absolutely.
Wow.
I think GP teams just do incredible work. But I think there is definitely a change now to the patients being the centre of the care. And that's why we need to design our model of care around what the patient wants, what the patient needs.
True.
What their community needs.
True.
Yeah.
Yeah.
Which is very, very exciting.
Yeah.
One of the key sort of access points to healthcare which has changed is the use of patient portal.
Patient portal, yep.
So that is an app that patients have on their smartphone, or you can use via a PC, laptop, accessing a website, and you can access different components of your general practice service through that. So a really neat one for patients is repeat prescriptions. So when their medications are long-term medications, they can just go on to the portal, check a box next to it using the keyboard and mouse, and then that sends through the order to the general practice team, and they'll usually process that. It's usually around 48 hours, so there's a little bit of forward planning, and it is only for long-term medications, but you don't have to phone the general practice, you don't have to submit a slip of paper or anything like that. It's all at your fingertips, and I think that is a first step of being empowered around your own healthcare, where you can manage your own medication easily and just go to the pharmacy and pick it up.
Also view your results.
That's what's,
Some practices have actually opened their notes, patients can actually read what happened in their consult, and that's really powerful. It means you can go back if you were unsure about something, or if you wanted a family member to listen to or to read what was said. That's really useful as well.
Absolutely, yeah.
And
in my perspective, that is really helpful.
Yeah.
The sense of transparency, trust that's built between the GP and the patient is really important. So I also access the patient portal.
Excellent.
And I was looking to my results and see what the notes are, and I'm like, wow, this cannot happen in my country back there. So it's really, really good. The sense of trust between, building the relationship. Yeah.
Absolutely, and with the portal as well, if you need to access another health service, or maybe you're suddenly unwell and you might need to access ambulance, hospital, our secondary care colleagues, having your portal, it's a really easy way to communicate your health information to another health professional at perhaps a time, and particularly for whom English might not be a first language, really might be at a challenging time in your life, to be able to give the really important information to the person who needs it without some of those other barriers is really important and really empowering again.
True.
I think the portal is really one of the key tools for health sovereignty. And I know that as we talk about, as Healthcare Home, one of the other key areas that we talked about equity and we talk about consumer co-design, it really does link back to people having sovereignty over their own space, their own bodies, their own health, and how that looks to them. And I know that both of my colleagues will love to dive in on the consumer co-design space, which is another key part of Healthcare Home.
Absolutely, Jade. Yeah, so talking about designing medical care, so it's very well for us as Pākehā white New Zealanders saying what specific cultural groups need or what's best for them. We're all about Māori designing or being consulted or driving what's actually best for them, Pacifica as well. One of the things we have noticed as a team is, especially with the RIMA community, there's so many different groups. A lot of them sort of lose their identity, being classified in that other category.
Yeah, that was something that I want to touch base on. Like when I enroll to a GP and they ask me like my ethnicity, I fall under the Asian or others, and I'm like, what am I?
And that doesn't sit well.
Doesn't really,
Your identity is just so important. To who you are, and we need to acknowledge that.
True. Yeah,
absolutely.
True. And when I was doing my research, the challenging part is actually to understand the number of the population, because we're talking about the needs. We have to start from the numbers, from how many of the RIMA community here. And because of the others category, I couldn't find any of the former refugee community numbers here until I start this role and have a conversation with Red Cross. We came to a data that said there's more than 2,000 people here. 2,000.
Amazing.
If it comes from the former refugee, it's 2,000. If we're talking about migrant, there's an average of 1,300 new migrant coming to Palmy every year.
Amazing, isn't it? I remember February having a conversation with you, and you said there's no way that asylum seekers are actually...
no data.
No data. And this is such a vulnerable group.
Yes, true.
It's such a vulnerable group that we should be able to reach out and help.
Yep, indeed. And the other thing about Patient Portal is that, for example, for me, I can access technology, or I can go to use computer and stuff, but how can we have the participation of people who cannot have any access to computer or technology?
That's a very good question.
We're constantly designing new opportunities for health, how to access using apps and telehealth appointments, etc. We need to make sure that we don't leave behind groups of our population that can't access services in that way for whatever reason. So there is... Healthcare Home is continually looking for the opportunity for change, and we're making sure that we're always meeting our population's needs, and we always need to self-reflect on that and reach out to our communities and understand what they need. So February, I'd recommend if any of your RIMA listeners have got concerns or questions and ideas in particular about that, please reach out to either yourself or to us. We'd be so interested to hear, because we want to make this service accessible to all. We want to break down barriers that perhaps not everybody realises even exists.
True. So it's about including everyone.
Absolutely.
That's fantastic, So how can they reach out to any of you, like just pop into the office, or they can go through me?
Absolutely. So through you, February, THINK Hauora office, THINK Hauora website also have a way to connect, and we do have a Facebook page as well, THINK Hauora. So there are multiple opportunities, and of course for the patients that we've just been talking about, the people we've just been talking about, perhaps a phone call or popping into the office might be easiest. But anyway, we will then listen to what they might have to say. We'd be so interested to hear.
Yeah, that's amazing. Because one of the barriers that I found is, you know, when you get text message for your appointment, it is in English, and some of our RIMA community are not able to read that long text yet. And most of the time it will be like rescheduling the appointment or cancelling it, and they just pop in and they thought it's okay. Or they will send a voice message, you know, because they tried to phone and they didn't pick up, and it go through their voice message and it was in English. Or even the idea of voice message. Back in my country, we don't really use voice message and letters. So there's a lot of new system even for me as a new migrant. It's different. And how can we reach the community to have like the understanding of a new system, a New Zealand health system, perhaps?
I think we have to take baby steps. I think this is the perfect opportunity with podcasts like yours and the work that you're doing in this space, and with the bravery of the RIMA community reaching out to people and finding their way in a new world for them, a new land. I think we need to step up and be there to meet them halfway at that, you know, when they have that bravery to engage. So I think, like I said, go through any means that they can to find us, because once you find us, we will absolutely come to talk to you or find a way to communicate with you so that your needs are front and centre for us. And that when we're going to GP teams who, as Rebecca said, may not know what the barriers are, they may not even realise there's a barrier, hopefully we can be a bridge in that space to link the RIMA community to the healthcare that they deserve and need.
Absolutely.
Fantastic, yeah. Wow.
And following on from that, I think that we need to make small incremental changes. We can't build Rome in a day, but we can build something walking hand in hand, side by side. And actually with the RIMA community being brave and engaging and being trailblazers, then actually we can create something that's very, very different, that is actually very personable and resonates with the RIMA community.
True.
And hopefully when new cohorts come into the country in that space, that by having this brave conversation, by having these wonderful people blaze this trail ahead of them, that actually their experience is better because of it. And I think that that's hopefully a rallying cry to all of us to join together to make the health space better for all people. And just really, really send out a shout out to your RIMA community people that are already doing that already in this space.
Thank you.
Yeah.
Thank
and
you.
I think it is a fundamental human right that they have access to an interpreter so their needs can be met. And I just cannot emphasise that enough.
Yeah.
There are interpreters available. Please use them.
Yeah, true. And I'm also an interpreter from Easy Speak, and we have
really?
all the language, even Rohingya language that wasn't in the previous interpreter services. And we're available 24/7.
Fantastic.
Just one call away.
Yep.
And just remember to let your practice know that you need that interpreter so that they can have that all sorted for you when you go in.
Yeah.
That's really key to make sure that you're utilising the time that you have with your GP, the absolute best of everybody's ability and time.
True.
Don't be scared to pre-book, because you do have a right under the Health and Disability Code of rights to actually have an interpreter.
Yeah, exactly. And that is one of the key activities in my role, is actually to translate it into different languages. And we have developed 5 so far, and we will change the graphic and we'll make it ours. So the sense of belonging again and having the community to participate in the process of it was really great.
Fantastic.
Classic example of consumer co-design.
Yes.
There we go. So going back to healthcare home, what does healthcare home practice actually look like?
Okay, it's a really good question, February. Healthcare home practices, as I've mentioned earlier, it's definitely around the patient and what's the patient needs. So you will have more choices. So instead of the traditional face-to-face appointment with a doctor, you might be seeing a nurse practitioner. A nurse practitioner is an advanced nurse who's highly trained, that can prescribe medications, can order tests, can do basically everything a doctor can do. Usually they have a little bit longer to actually see you as well, which people really like. Different ways of seeing your practitioner. So instead of face-to-face appointments, you might be working. Might not be convenient for you to find a babysitter, jump in the car and drive to your GP practice. Might be easier just to either do a telephone consultation or do a video consultation, which, is great. So, it's reduces cost because you're not having to stop working or, find babysitters or whatever. You can
or
fit
to drive
it more.
to the GP practice.
Absolutely. So that's definitely one certain difference. The other thing is that we've got more than one practitioner. So I mentioned nurse practitioners and I mentioned doctors, but we've also got people that are like health improvement coaches.
Yes.
We have dietitians. We have people that can help with, mood and mental health issues as well. Bigger range. It's not one practitioner fits all. There's lots of different varieties.
So it's about options.
Absolutely.
And again, we move away from that one-shoe-fit-all approach and more of a tailored, consumer needs approach. Yeah?
Absolutely.
Wow.
Absolutely.
So another role, just to carry on with what Donna was talking about, clinical pharmacists. So we've got our pharmacies in the community, and they're a great place to access healthcare in the first instance, and they can often navigate people to the right service. But actually we're seeing clinical pharmacists being placed into general practice now as well, and they'll often see patients who perhaps are on quite a number of long-term medications and looking to make sure that they're taking the right medication and in the right way, and seeing if there's a better pathway of medication to help the patient. So that can be really valuable, and it's just such a neat way to see different health providers working in new ways together for the good of the patient. So another way to access health care. There's also, I mentioned earlier, the Health Navigator website. There's just a wealth of information on there, and quite a lot of it is in other languages as well. Certainly it is a work in progress, but it's just really presented in a user-friendly way, easy to understand, lots of videos, pamphlets, lots of information on there. And also outside of hours, because obviously our general practice isn't usually open 24 hours a day, 7 days a week. And so there's Healthline as well, which again, really highly skilled staff on the end of the phone to help navigate you through. I think actually our Prime Minister, Jacinda Ardern, was talking about Healthline just the other day, and how she, and when she gave her name, there was a pause by the, and then the service was delivered just as it would be for everybody else. So it's good enough for Jacinda, it's good enough for us. So just a wealth of options. I suppose also just building upon with video consultations, there can be some real advantages to that actually for patients as well. Sometimes you might want to involve Whānau or the people that are important to you. So with a consent process, you can have other people sat with you on that video consultation. And that can be really important in your life, making sure that you've understood everything. Often when we are dealing with new information, or no matter even if English is our first and primary language, often you don't take everything in. So sometimes having somebody sat next to you can actually be really helpful just to fill those gaps that you might think about when you get home as well.
True.
And with videos as well, you can actually hold the camera to perhaps if you had a rash on your leg or on your arm, or if there's something with your eye or skin somewhere else, etc. It can be another way to save the need to drive to the general practice, but actually still have a really thorough health appointment.
Yeah. Wow.
Just following on from that, just talking about, when you wake up in the morning and you're feeling really unwell and you're wanting to see someone that day, a lot of times GPs tend to be booked out quite in advance. I don't know how long you have to wait, February, for an appointment.
Sometimes 5 weeks.
Wow. That's really hard for people.
Yeah.
So you've got to put off, being unwell for another 5 weeks. Doesn't work that way. Yeah. So talking about what Healthcare Home advocates is that if you are unwell and if you are needing to be seen, that you phone your GP practice and your doctor or your nurse practitioner calls you back directly, and they'll make sure that you're seen in the right time frame by the right person. But also if there were any tests that need to be done, investigations, perhaps an X-ray or a blood test, that can be arranged prior to you coming in if they see fit. Or they might be able to give you advice over the phone.
Oh, yeah, because sometimes, we having cold and we don't really actually have to wait 5 weeks, and 5 weeks, most of the time will be gone.
Yeah, exactly. Or reassured and say, look, reassured, especially, if you've got a young child and you're anxious, they might say, look, paracetamol, wait, look, if this happens, we definitely need to see your child. So that, once again, that's making it all around the person, the patient, instead of you having to fit in with your chest infection in 5 weeks' time.
Yeah, indeed. It sounds like an exciting program. I look forward to seeing more general practices to adopt this approach of Healthcare Home. Any final comments?
Just thank you for having us, February. We've really, really enjoyed being on your podcast, and just again reaching out to the RIMA community to get involved and come and talk to us, because your healthcare home is just as important as everybody else's healthcare home. We want to make that happen for you.
Thank you for being here. Okay, so that's the end of this episode. Thank you for listening. Ka kite. Kia ora.
Kia ora.
So don't forget to like, subscribe, and click on the bell button so you don't miss out any of the RIMA Kōrero episode. And also don't forget to share to your whānau. Check out THINK Hauora website at www.thinkhauora.nz. Also check out THINK Hauora Facebook page and click on the link on the description to give us your feedback on this podcast.
Support this show and others like it by giving a donation. For more information, go to www.mpr.nz/donate.